All right, let's talk about something that's super important for new moms, but maybe not talked about enough: healing those delivery stitches. This is all about giving you a clear, science-backed, and honestly, a stress-free guide to feeling like yourself again.
And this is really the heart of it all. You don't need to suffer through this or try a bunch of painful, old-fashioned remedies. The goal here is to empower you, to give you simple, effective steps that will lead to a much smoother, pain-free recovery.
Okay, so let's get on the same page. What are we actually talking about when we say delivery stitches? Well, during childbirth, the area between the vagina and the anus, it's called the perineum, has to stretch a lot. Sometimes it tears a bit on its own, or a doctor might make a small controlled cut to help. Afterwards, they use these special stitches that just dissolve over time. It's incredibly common, a totally normal part of the process. To really get a handle on this, I want you to picture something. Think of that tissue down there as a living sponge. It's packed with blood vessels, which means your body designed it to heal really, really fast. So our job, our only job really, is to help that sponge do what it does best. And we do that by keeping it clean, dry, and getting lots of oxygen to it. Simple enough, right?
Okay, let's jump right into rule number 1. And honestly, this is the absolute foundation of everything. It's all about hygiene. We're creating the perfect clean slate so that living sponge can work its magic without any interruptions.
Now, the first part of this rule, it's strict, and for a very good reason. You've got to change your maternity pad every 3 to 4 hours. And this is the part people miss. You have to do this even if the pad isn't full. A damp pad becomes a perfect home for bacteria, and that's the absolute last thing we want anywhere near your stitches. Washing with water is great, but how you wash is what really matters. So, a few key things. If you're using a jet spray, please put it on the lowest possible setting. You don't want to blast those stitches. And always, always wash from front to back. We're trying to keep bacteria away from the area, not drag it forward. And when you dry it, just gently pat. No rubbing. This tiny little detail makes a world of difference.
All right, on to rule number 2. And I'll be honest, this one might feel a little bit like a mini spa day, but trust me, it's powerful stuff. The sitz bath is basically your secret weapon, your way of telling your body, okay, let's speed up the healing. And the best part, it's so simple. We're talking just a few inches of plain, lukewarm water in a tub or a special basin. That's it. You just sit in it for about 10 to 15 minutes, 2 or 3 times a day. So what's the magic? Well, that gentle warmth draws all this fresh, oxygen-rich blood to the area. It's like your body's own natural healing glue, and you're just helping it get where it needs to go.
Okay, so you've done a great job with hygiene. Now comes the next critical step: getting totally, completely dry. Let me be clear, moisture is the #1 enemy of healing stitches. It can make them soggy and weak. So this step, it's an absolute must.
So how do you do that? It's pretty easy. Just lie down on a clean towel, no underwear, for about 10 to 15 minutes, and just let the air do its thing. A fan can help speed things up. And here's a game-changing tip, especially if you live somewhere humid. Grab your hairdryer, put it on the cool setting, not warm, not hot, just cool, and hold it about a foot away. It works like a charm.
Okay, so we've got the outside environment under control. Now we have to talk about protecting your stitches from the inside, because, believe it or not, the single biggest physical threat to your healing wound is pressure. Specifically, the pressure from being constipated and straining when you go to the bathroom.
And the solution starts with this number, 3 liters. That's your daily water target, minimum. This isn't just a friendly suggestion, it's your defense system. All that water keeps your stool soft, which means you don't have to strain, which means you're not putting all that pulling pressure on your stitches.
Now pair that water with high-fiber foods. Think pollock, ragi, papaya. But then there's the bathroom setup itself, which is just as important. If you have an Indian-style toilet, you have to avoid squatting for the first 2 weeks. The pressure is just too much. If you have a Western toilet, a little footstool to get your knees up is the perfect trick for making everything, well, easier.
And our final rule is all about movement. But here's the thing, you can't move if you're in pain. So please, listen to me on this. Don't just tough it out. Managing your pain isn't a luxury, it's actually a crucial part of your healing process.
You've got to take your pain medication on schedule as your doctor prescribed. That's what gives you the freedom to get up and do some gentle walking around your home. And that movement is so important. It gets your circulation going and helps prevent serious things like blood clots. Then, after about a week, you can start doing some gentle Kegels, those pelvic floor squeezes, to actively pump even more of that healing blood right to where you need it. Okay, this brings us to a really important part, busting some common and frankly dangerous myths that you might hear. A lot of people might tell you to put things like Dettol, turmeric, or even ghee on your stitches. Here's the reality. Harsh chemicals can literally burn the new, delicate cells your body is working so hard to create. Plain warm water is not only safer, it's scientifically proven to be more effective.
And here's another one that is so dangerous, and it goes directly against what we just talked about, the idea that you should not drink a lot of water. This makes absolutely no sense. We know that being dehydrated makes you constipated, and we know that straining is the #1 reason stitches can break. So please, drink your 3 liters of water.
And then there's the big one about food. You've probably heard it. Don't eat dal or spicy food, it'll cause pus. Let's be crystal clear. That is just not true. Pus comes from one thing and one thing only, a bacterial infection, not from what you eat. In fact, the protein in things like dal is literally the building block your body needs to create new tissue and heal. Your body needs that protein, so don't cut it out.
Okay, let's shift gears for a second and talk about something really serious. Your body is amazing at healing, but you need to be your own best advocate and know the signs that something's not right. Knowing these red flags means you can act fast if you need to. You need to call your doctor right away if you get a fever with chills, if you notice any discharge that smells foul like sour or rotten, if your pain suddenly gets much worse, or if you feel a heavy, bowling ball kind of pressure. Also, if you can see that your stitches have opened up and there's fresh blood, or if it hurts badly to urinate or you can't go at all. Don't wait on any of those things, just make the call.
So, let's wrap this up with a really powerful thought. What your body just did, it's a genuine miracle. And now, the focus has to be on you. You've absolutely earned the right to rest, to heal properly, and to give yourself the kind of careful, scientific care that you truly deserve. So, I'm going to leave you with this one question to think about. Healing isn't just about a physical checklist, it's also about your mindset. With all the chaos of a newborn, how will you find just one moment to give yourself the grace you so deeply deserve today? Thank you for listening.